Hello, hello, hello. Happy Tuesday. Happy April 2022. Happy April. Happy birthday to everybody celebrating their birthday in the month of April. Welcome to Abby Tyler's Healthy Living. This is my Tuesday show. Happy birthday to everybody celebrating their birthday in the month of April. So, happy birthday to you. Happy birthday to you. Happy birthday. Happy birthday. Happy birthday to you. So, for those of you who will be watching along with me, I say thank you. For those of you who will be watching later, I say thank you as well. So, we're in spring, it is April. Just not going to be like a long conversation, but just give me 2 seconds again, like I always do every time. I'm just going to go in here and I'm going to put this one. Post. And go in here. One more. Okay. Alrighty. Again, hi, my name is Abby Tyler. I am a family nurse practitioner, as you all know by now. And those of you who don't know me, my name is Abby Tyler. For those of the new people who like and follow the page over the past month, and I think the month before, I'm not sure if I mentioned it. Welcome. Thanks for taking interest in this forum. I post every Tuesday, mostly every Tuesday. Sometimes I'll come on Thursday, and sometimes I'll come on Friday. But Tuesday at 7 o'clock is my regular day. Okay, so again, as you see the title of the show, I'm putting my glasses on. You see the title of the show. It says "Combining Conventional and Traditional Medicine: The Risks and Benefits." Okay, so I already did the birthday stuff. So today's topic is about, it's not like alternative medicine where you instead of following what your doctor, your conventional doctor, I don't want to say Western medicine, but since I'm training Western medicine is what I'm going to talk about. And so it's not saying I'm not going to take that medication, I'm going to take something else, I'm not going to do that therapy, I'm going to do something else. This is complementary and integrative medicine, meaning whatever it is your doctor's doing, if you're working with somebody else who's trained in that field, then they can work along with your doctor to help you to take care of your illnesses. So, as always, my disclaimer: whatever it is I say here is for informational purposes only, for my practice, for my education and my practice. And make sure you don't change any regimen without first speaking to your family provider. Okay. So, so the field of medication, the field that we in healthcare that's complementary, is called complementary and integrative medicine. So I'm just going to give you a little bit information there. So some practitioners back then, not right back then, about 20, 30 years ago, more formally adopted integrative medicine in the early 1990s. In 1994, the University of Arizona Center for Integrative Medicine was founded with a primary focus on educating physicians in integrative medicine. Now, nurse practitioners will also do that because we're providers. The academic collaborative for integrative health was developed in 2004 to promote policies and action to advance integrated healthcare throughout the United States. Today, integrative medicine is an internationally recognized movement in medicine. So this topic was actually inspired by, I was watching the Focus on Liberia. If you can go, they had a show on Sunday. You can go back and watch that. It has somebody on there who's I think it's like natural healer or something. Sorry, I can't remember his title. And then also when I was in school, I also took a class that it's called Holistic Living for the Caregiver. So I loved it. We talked about so many, it was like 8 weeks. It was like mini therapy every week, because when I was in there during that time while I was in school, two of my relatives died suddenly. So it was okay to go in there. And it was almost like sitting there every week. I told my teacher, I say it felt like I was there and watching Oprah Soul Sunday every week. We did our journaling. We talked about different issues and different methods. Okay, so complementary medicine is used together with mainstream medical. An example of that, we like acupuncture to help you with the side effects of cancer treatment. When healthcare providers and facilities offer both types of care, it's called integrative medicine. All right. So, like I said, it's not alternative medicine. So, I'm not coming on here to do anything about alternative medicine and telling you not to take your medicine. So, this is mainly like a short little conversation, and we'll be talking about the risks and benefits. I'm going to do most of the benefits first. Okay. So the type of people who are trained into that is it can be like your physician, PA, NP, but they have to get that specialized treatment and specialized treatment and also training so to be able to integrate it into their field. But there are also people who only do that, like doctors and different providers. You can go to that only perform that, and together they whatever when you see them and go over your history and everything, whatever they do, they send that information to your regular doctor, so your regular provider, so you guys both can be working in together. Okay. So since most people who know me, I've had this forum since 2014 when I had my other, when it was on just a regular group page. I've always kind of incorporated complementary care into the Western medicine. I did my gardening. You guys saw me doing gardening. You know, gardening can be really soothing, even though I wasn't even the one doing the gardening. My husband was, but just doing gardening and sitting there and putting your hand in the soil and all what it is doing fruits and vegetables to eat or just regular flowers that can make you really relax. You know, when you have high blood pressure, you have anxiety issues, that can also help when you're doing things like this require nice and calmness. So it's not like you're not taking the medication if your doctor prescribed that for you, but you're also doing other things. So you won't need the medicine that much because they work together. Okay. Gardening. I did gardening. I talk about walking in the forest. With me, I love walking in the forest. I love going to the waterfront, as you can see my picture on the head in there. I love going to the ocean where I just sit there and then during the regular months, I go sit at the waterfront with my family, and I find that to be so soothing. Everybody who's on my personal page can see all the different pictures there. Okay. Let me see. So, and also for fee for food, because people will say, "Oh, when you go to the doctor just wants to prescribe medication for you, and they want to do this and want to push and big push it big pharma, push people like me, not people like me." When my patients come and all that, when I notice your blood pressure is a little high, now considering everything else, not true. I'm looking at the bigger picture. But if your blood pressure is high for the first time, if you're not symptomatic, you're not having like chest pain, you're not having dizziness, you're not telling me anything else that's going on, and your blood pressure is a little slightly elevated, I may tell you go home, your blood pressure is a little okay. We're going to check it again. And if it's really high, we'll do something about it right there. But I say go home, make sure you eat healthy, make sure you exercise. And if you're already on medication, continue to take it. If you're not on medication yet, I might check it again. Because sometimes people come to the doctor's office and it's just high, so white coat hypertension, where you're in the office and you're nervous, so your blood pressure would necessarily be high. So I can just base it on that and go back and I'll tell you how to eat, try to eat like we talk about the DASH diet, DASH, dietary approaches to stopping hypertension. So we do a lot of normal things. If you work in a real stressful job, we tell you how to find ways to kind of not, work down, release the stress, and also your blood pressure doesn't stay high because the body responds to that. So we do a lot of things. So this is all part of like the integrative medication and all, but this is part of our teaching as well. So in vet, we do everything so you don't have to get on the medication. But if you have to get on the medication, you have to. But even if you do get on the medication, you're still going to be practicing different things that's going to keep you healthy. That's going to keep you so we're not increasing the dosage of the medication because your body is not responding. Now that is besides if you have like other kidney issues and other things that may cause your blood pressure to be high. Okay, so when you're doing and also we have the other branch of healthcare too, where people who doctors and different practitioners who also prescribe like vitamins and things like that, nutraceuticals. The most important thing is like when you go to your doctor's office and you tell them we're getting your list of medications and all that, you want to make sure you tell us everything that you're taking. And to say you're a new patient and you're coming from another doctor or you're coming first, well, the reason we make sure we get a whole list of your medications, including vitamins and minerals and all that, because even though vitamins and minerals, they can be safe, but in taking a higher dose, it can become toxic. And also at the same time, they can also interact with other prescribed medications. So we want to make sure that you tell your doctors on that. So if you are interested in the complementary integrative medicine, you work closely with your practitioner. They'll develop a personalized wellness plan based on your immediate health needs. Again, you're going to be working with that person and with us, and so like I said, some of us we're training holistic medicine and all. You'll be encouraged to develop healthy behaviors, self-care skills used throughout your life to fulfill and sustain your long-term goals. Complementary. Okay, I'm just going to call it CAM because yes, complementary and integrative medicine. They emphasize on practitioner-patient relationship and based on the model focusing on health and wellness rather than the model of the disease. So we kind of focus on most on that. Those who are trained on that. By personalizing care for each individual, integrative medicine treats more than just the symptoms. Okay, you and your practitioner, we address the causes of the illness, including biological, psychological. Again, like I said, if you're having issues that other issues that's causing your blood pressure to be up and your blood sugar, and all, normally we talk about that in regular practice, anyways. And behavior issues, environmental issues, depending on where you are. You can be living somewhere where it's very stressful there, and then you we might talk about, okay, are you able to move away? Are you able to do things? If you can move away, are you able to do things that will keep you safe? My internet is acting up, so I'm sorry if I'm pausing. I can't tell if I'm pausing or not. Okay. All right. So most of these people, like I told you, they have specialized training and the licensing based on the jurisdiction, because some places don't recognize the license for this, and some other doctors may be like, just quack theory. You can go there and do this. You don't need to be seeing those people. And also, but it's internationally recognized branch of healthcare. Okay, so in addition to conventional treatments, the therapies are used, proven to be effective, safe, and appropriate for personal health needs. All right, so some parts, like example of what they do, functional medicine, like they help you when you're sitting there talking about deep, intense connection with yourself, within yourself. They help with depression, lupus, inflammatory diseases. Guided imagery, like you can see, I have my picture there. Like I told you, I go somewhere and I sit there next to the waterfront and it's nice and relaxing. Or we're going to park and just walk in the park. This is one of the things. Let me see, hopefully this will show. Let me just see here. Like, see a picture that we're walking in the park. That was 2 years ago, 2020, and we're walking in the park. That was when COVID had come back the second time around. I was in school. It was so stressful. So it just felt good to just be able to walk into park and just relax, and just taking everything that's part of, like, it's called guided imagery. They do hypnotherapy where they put you under, and not put you under, but they sit there and have like a therapy session where they really, that's like intense, and they're talking to you and making you feel good and putting you into a happy place. So you can also do that. I also promote music. I used to do a lot of music before when I started. Whatever it is, your religious thing, you can do that with meditation as well. If you're non-religious, you can do meditation. There are religious meditation. I try to do meditation, but my thing is, as soon as I started to do it, then my brain started thinking of 10,000 different things. And then I have to like catch myself and come back. So I'm not really good at meditation, but I'm good at sitting home and just kind of relaxing, or being at the waterfront and just sitting there and just let the water just kind of wash away and just kind of relax. That's my main thing. Water, music, I'm there. Or in the forest, I'm there. If you're looking, that's where I'll be. So they do you can do natural supplements, like I said, the vitamins and minerals, vitamins and all that. It can do other things, and other things that can that's not prescribed by your regular doctor, but they can do that again in conjunction with your regular doctor. Therapeutic massage and yoga, all of that, because you're sitting there, you're doing yoga and you're stretching your arms and the slow movements and your deep breathing and all that kind of helps everything. If even like blood pressure, brings your blood pressure down, lowers your heart rate, lowers your stress level. Like I tell patients to, when I see them getting anxious, we do the deep breathing. You can go in there and just, like I tell patients, I'm like, okay, breathe in, hold it in, and then hold it, and then breathe out. Breathe slow, like you're trying to blow in nice little feather, tiny little feather away. So you do that when you find yourself hyperventilating and you're getting nervous and other things and all. And even when I used to work in the hospital and I was giving my patients medications with their IV, like to say, because I work in the heart floor and their heart rate's like bounding all over the place. And we go in there and I'm giving them the medication, and I'm like, and they're like, okay, I'm gonna pray. Oh, okay. I say, you know what? If it means for you to pray, go ahead and pray, relax, and all that. I say, I'm doing what I'm doing. You do what you do, and you believe in your higher power. If that's going to help you, I never say, oh yeah, no, that, no, no. It's all like I said on my forum, body, mind, and soul. I don't just believe in just taking care of just the disease and the person. It's everything that comes along with them. So whenever you go to see a provider, if you're a provider, if you always ask them and say, do you believe in all those other things? Doesn't mean that, okay, we're going to say stop taking your medicine and all, but you want a provider that believes that you're not, I'm just looking at the person and the disease. I'm also looking at everything else that comes along with that. And you can usually feel it when you're talking to somebody who's taking care of you. Okay, so some of the conditions they treat, like anxiety, arthritis, cancer, again, in conjunction, you'll be still taking your medication. Most cancer places now, they also have like the therapy session there. They have coaches there to kind of talk you, the navigators, and they give you all the different resources that you need to do while you're going through treatments like that. Diabetes, all of that. I mean, the healthy eating, all of that we do. PTSD and the work to there. But so anything that's kind of inflammatory that they teach you healthy eating, same thing that we do. But like I said, train to that, and then in conjunction to that, they help you with anxiety and just it's some people how like they're really sick or they're going through stuff, and then you're like, how is that person even like going through that? And I would be like on the floor, and I'll be so depressed, and it's like the person be like, you know what? I'm doing what I need to do. I listen to my music. Oh, I'll play with my pets. Or I'll go visit my grandchildren. I'll go hang out with this person and do this and all of that. That's all part of just integrating all that stuff into your body, integrating it into your system, so you know very well that okay, this is what I have to do to keep myself healthy. Doesn't mean I'm not worried about everything else that's going on, but at this moment, this is what I can handle. I can only handle what I can handle. And like my grandmother and other people like, and I'm just leaving the rest with God. But I always taught them, I said, do what you have to do. Do what you have to do to stay healthy. Don't just say I'm leaving the rest with God, because even the pastor, popes, and everybody they go to the doctors too. So do everything what you can do. And I tell my patient, I'll do what I can do. You do what you can do, and we leave the rest with God. And and especially if they'd be like, oh, okay, yeah, that makes sense. So even churches have most churches like try to and do the exercise program, because this I remember one pastor said, he said I one time he was like burying all these people, and it was the same thing for hypertension, for diabetes, for kidney disease, and over he said, I'm tired, like being at a funeral while I'm doing this all the time, and instead of being like trying, why don't we do something? Why don't we teach our people how to eat healthy? Why don't we teach them to get up and move around, not to live a sedentary lifestyle? Yes, I know we want you to believe in God. Yes, I know God can do everything. But at the same time, you got to do what you have to do and let God do what he has to do. And for those of you who don't believe in God, if you believe in a higher power or the universe, whatever it is, because sometimes I say that, I'm like, I'm just going to let the universe take over and just relax. Okay. So again, it doesn't replace the care you receive from your primary doctor. Instead, it complements existing treatments prescribed by your primary doctor. Okay. And like I said, some people get the training to be that. And also it could be you seeing that other doctor, and also and then following with your conventional doctor. And as for those of you who most of I'm from Liberia, so we know all the different kind of combinations to add. I mean, growing up every Saturday we're like Jollobo and all those different things, and street stroller to boil it up, and then you had to drink it to cleanse your body. The most important thing is to always remember that if you're doing anything that's outside of the conventional medicine, if you're doing jollof, I don't know what the plant is, the name for that plant that we used to drink that, and the street stroller and all, make sure that you have the scientific name. The reason being because if you're in America and you're taking something that's outside of America, because most people have those different stores that you can go to. And if you go to the emergency room, if you have any issues, it's just going to take a longer time to get to a diagnosis, because that is not something that they deal with. But at least if they have a plant, and they can just look it right up and everything, look in the medical dictionary, and then say, okay, this is what she's having an allergic reaction to, or this is what we're doing that. Because even with, like I said, take grapefruit juice, or drink grapefruit, have grapefruit, because it lowers your blood pressure. But at the same time, as a trained clinician, I have to know that if you're taking medication also for your blood pressure, you don't want to be combining the two all the time, because if your blood pressure drops, you could suffer severe headaches and head injury and all. And at the same time, it's like, okay, what if you already had low blood pressure? Some people have low blood pressure, so, and if I tell you, oh yeah, just go ahead and do that, and your blood pressure drops even lower. So you want somebody who's trained in conventional medicine, and also if they're bringing that. And like I said, we used to have castor oil and also Vicks. I mean, Vicks was the healer of everything. But at the same time, you can sit there and rub the Vicks all over your chest. We used to do that, rub it in the nose and on the whole body. Your whole body would be rubbed, even Vicks vapor rub. But you have to also know that you can do that. That is supposed to help you open up your passageway. But if you had pneumonia, that Vicks is not going to help the pneumonia. So this is where I'm saying you want to make sure that you do dealing with somebody who knows conventional medicine and also combine the two. All right. Let me see here. 1 second. I'm gonna just open up here. Okay. What did Jackie say? Jackie said there are some medical providers who love to push medications on people, especially from different cultures, and so I hate that. they're not culturally educated, and this is so frustrating. That is true. That is true. And that's what's important. So when you do find a new provider, you want to make sure that you say, somebody said make sure a lot. Sorry. But you go there, you tell them and say, this is what I'm dealing with. I'm a little eerie about taking medications if I don't think I need it. And if that provider is like me, they're trained and they know that. And they know most of the people that come in now, we know they're educated somehow in some with their medications and all. But like I said, we told her we like patients that are coming that are somehow educated, but there are some patients that are coming in and they come in with like a whole thing of Google information and this and no, they say my friend was taking this and this happened to her, so I don't want to take it and this and that. They're not going to push anything on you that that if you say I don't want to take it, it'd be like okay, so you declined it. And even some people we give them the medications and they still go home and don't take it and then come back and they still having the problems and you're like, why didn't you take your medicine? But oh, well, at that time, oh, I didn't have any symptoms and I'm fine. And there, so it's the low back and forth. You just have to develop a good rapport with your provider, and then you come to understand and say, okay, yes, I'm a little medication eerie, and because I come from a culture that I don't think I need to take too many medicine and this and that. Usually, your provider would know that and tell you, okay, I'm prescribing this medication for you now because you need it. When you let's say if I put you on medication for diabetes and you're taking it and you're eating, I tell you eat healthy, watch what you're eating. If you eat anything like cultural, like a lot of us we eat rice, and it's not just like my culture. A lot of people eat rice, or you eat pasta, you eat something heavy. So I would tell you kind of cut back on the rice, do a lot of things that's going to cut back on pasta and white bread and all. So if you're coming back over a period of time and we're checking your blood sugar every your A1C, go back and watch my diabetes show, like every 3 months, every 3 to 6 months, depending on what your insurance and all that the practice does. If the numbers just start going down, we're going to decrease the amount. And then because type 2 diabetes is totally reversible. So if the numbers are going down, and if your cholesterol numbers are going down, we're going to start decreasing the doses, and blood pressure, your weight is down, you're eating healthy, and things are looking good. And we do the blood pressure, and we're doing your blood work. Yeah, eventually we're going to take you off. But you can come to the place there, and your blood pressure is so high, even though you're asymptomatic, and we say you're going to need to start medication soon, and you say no, no, you've got just like to push medications and this and that, then you're going to run into a problem because, like I said, sometimes the first sign of a heart attack is a heart attack. The first sign of a stroke is a stroke. So you don't want to be that person that's sitting there. As some people have the chest pain, dizziness, and this and that, and if they get into the hospital in time, you can catch it in time. But you don't want to be that person that gets the first sign, which will be the major attack. So it's also important develop a good rapport with your patients. And if you have an advocate with you when you go into the doctor's office or somebody listening on the phone, most of the time you're just going to say, okay, I got my relative who's on the phone. They're going to be listening to, is that okay? And most providers just say, no, no problem. Go ahead, I'll listen. They can listen and then we can talk to them too. Sometimes don't do any days where you're rushing when they're really rushing, but just kind of have them on listening and they can ask a question. Most times we have no problem with that. Okay, so it's all about developing a rapport with your providers. All right. Let me see here. So I did that. Um, so many going there. Okay, so if you're interested, the thing about having go into complementary integrative medicine medical doctor is you want to check if you're interested in stuff like that. Check with your insurance provider to determine if the cost will be covered. Because, like I said, some insurers are like, no, if it's not conventional medicine, we're not doing that because we don't want to be playing around too much with too many different things. And like I said, even though it's been around for over 30 years, still there's still some people who like I don't trust that yet, so we're not going to cover it. You can go there, but we're not going to cover it. And some companies, some don't cover it at all, some cover some of it. So you want to check with your insurance company, check with your own doctor too. And don't sorry doc, don't say, oh well, you know what, I really trust what you're doing. I mean, you're not going to say that, but you can say, I checked with this person who told me to be doing this. I have some patients who they tell me to come here. Okay, I say, what are you using for the pain? And they tell me I'm using this, I'm using that. I'm like, okay, as long as I know what it is. So, and I add that to your medication list. So we'll go to the caution and the risk now. Okay. So please remember to go to somebody who is trained in it and who has knowledge and licensed to do it. So you want to make sure when you check in on that and you call the office, make sure you ask for that. And again, if you're taking any medications that are made in kind of root or whatever that is supposed to be want to make sure that you know the name of the root and the scientific name, at least have it in your phone. So in case if you go to the hospital, you go to your doctor's office, they can write it down. You want to make sure that they have your full list of medication when you go to your doctor. Every time you go to your doctor, have a full list of your medication, including anything over the counter, regardless of how small or insignificant you think it is. Make sure you bring it to their attention because it's important. Again, like I said, with the medical history, if you have certain issues that certain plants a plant-based thing, too much vitamin is not good for you. Just because it's vitamin doesn't mean, and it's not heavily regulated, so people you can buy over the counter. So you have to, check with your doctor. See, wait a second, is this safe for me to take? Um, and I told you, if you take any foreign medicine, make sure you know the name because some people can buy medications from overseas too. So you want to have that with the list, all the list of your medicine because of safety, and also if you have an allergic reaction, so for any kind of reversal thing. So and we don't most providers, and we also like they teach that in school all the time too. It's very important that if you go to a provider and say, "Oh no, I'm using this for my country, I'm doing this," most people be like, "Oh, I usually like I tell my patients, I'm like, oh, okay." And I'll ask, I'd be like, what is that? What does that do? What is it? What's in there? Can you bring it the next time so I can see what it is? And then I include that in my note. Because sometimes you're putting in medications you prescribing a medication and there's an interaction with something you're taking, that could be deadly to the patient, all right, or could, cause life changes in their life. So you want to be careful of that. That's the most important thing. The precautions is make sure you're going to somebody very who is skilled in this, who is trained in this. Make sure that they have your full medical history, including your surgical history. Because what if you have something taken or added to your body? You want to get that, and know the names of all the foreign things. But it's important because I remember when I had surgery many years ago and I was like nauseated. I was like, I could not keep anything down. I didn't want to eat anything because everything just tasted so bad in my mouth. And one time my husband, he was like, okay, I'm just going to cook some soup. And he made some pepper soup. Oh my goodness. I'm the kind of person I can't take too much pepper, hot pepper. And I took it and I was like, whoa. And it literally kind of cured my nausea. So I was like, I went to work. I'm like, oh, I was talking to one of my GI doctors. I said, you know what, we can work together. So by the way, nobody steal my idea. So I said we can work together and get some hot peppers, I'll bring it in, we can go to the factory, fix it up and all, and that can help with nausea because all the medications, that were ordering for me for my nausea, nothing worked. This hot pepper just kind of killed everything and I was able to eat and get my appetite back. So who knows? But of course, hot peppers with again coming back to the educator side, hot peppers if you have gastroesophageal reflux disease, which is like indigestion, bad indigestion and reflux, you don't want to take too much hot pepper as you get older. It kind of affects your stomach lining, and most people are like, oh, I've been taking this forever so I'm good. But no, you want to make sure that you following the doctor who's doing that, know your past medical history, and will tell you, advise you accordingly. Okay, so like I said, it's happy April, nothing heavy. I didn't want to start with anything heavy the first month of the first the first Tuesday of the month. So I don't see any other questions here. Let me just look and make sure because sometimes I get off and then people say I already didn't see my stuff. So alrighty, so again, make sure you go to somebody safe that knows your best interest. Develop a good rapport with your provider, and if you're interested in things like that, check with your insurance company and see if they cover it, parts of it, or none of it at all. And but you just go online and look up complementary in integrative medicine. Bring that to your doctor's attention the next time and see. Remember, they work together to keep you healthy and to keep you safe. Okay. So I am done for tonight. For those of you who have watched it now, and I say thank you very much. For those of you who will be watching later, I also say thank you to all my new members and new followers and all. Thank you. Those of you who have been with me from day one, way back in 2014, I say thank you as well. So until we see again, I will try to see if I can come back on Friday. I'm not sure, but maybe Friday, something lighter on Friday. And I may just pop up on Thursday every once in a while with something when I get, I guess I'm like, oh my God, let me come on. So thank you all for watching. And I will talk to you guys at a later time. All right. Take care. Enjoy your April. Be safe out there. Please be safe. Okay. And good night. God bless. And oh, one more thing I did for my holistic living, we did a lot of things on Dr. Wayne Dyer. He did a lot of stuff. He talked about different things. And Miriam Williamson too. So we read some books on there, just some essential oils and everything. So think about that and talk to and breathe. Dance. I love dancing. Those who see my page know I love dancing. Listen to some music, do some deep breathing. Don't take everything to heart. Don't when people saying stuff, energy vampires on Facebook, the ones who you get on and they're arguing, and they want to make, sometimes you get into it, you want to, keep pushing your point and you want to do that. But it gets to a point, don't, it's not even worth it. Just say, okay. And then just relax and fight another day. But don't let it stress you because at the end of the day, you have to be careful. You have to be healthy for you and your family. So thank you all for watching and good night. God bless. Namaste.